Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for watching this video. This video is on standard on therapy, the last chapter in our course information. Okay, so in this chapter, we are going to discuss 10 standards which is related to standard on therapy. Some of you later will become clinical psychologists, so you need to know what is or what are the ethical conduct that you need to follow, that you need to adhere to when you become clinical psychologist, when you are able to conduct therapy, when you are able to entertain client or your patient. So in these standards, we are going to discuss 10 substandards or 10 standards related to therapy, which are 10.1 informed consent to therapy, 10.2 therapy involving couples and families, 10.3 group therapy, 10.4 providing therapy to those served by others, 10.5 sexual intimacies with current therapy clients or patient, 10.6 sexual intimacies with relatives or significant others of current therapy clients or patient, 10.7 therapy with former sexual partners, 10.8 sexual intimacies with former therapy clients or former patients, 10.9 interaction of therapy, and 10.10 the last one, terminating therapy. Okay, 10.1 informed consent to therapy. There are 3 standards that clinical psychologists need to adhere to when they are acquiring or they ask for informed consent for their patient or clients to therapy. First one, 10.01A, when obtaining informed consent to therapy as required in standard 3.10, which you have discussed before on informed consent, psychologists inform clients or their patient as early as feasible in the therapeutic relationships about the nature and anticipated cost of therapy, fees, involvement of third parties, and limits of confidentiality, and provide sufficient opportunities for the client or for the patient to ask questions and receive answers. So when you want to engage in therapy, you need to ask for informed consent. Okay, so this informed consent need to be acquired as soon as feasible. So as soon as feasible means here for some cases, okay, for some cases, informed consent is not we cannot get the informed consent whenever we are at the first encounter with patient. Okay, sometimes it requires some safety measures, some precaution for us to conduct first before acquiring informed consent. For examples, when people bring in patient who want to commit suicide, okay, at first and foremost, you need to conduct some preliminary analysis. You need to calm them down first. Okay, at that particular moment, it may not be feasible for you to acquire informed consent. After your patient calm down, after your patient be able to think carefully, after the guardians of the patients are present, then that is the most feasible time for you to acquire for informed consent. So in this case, it may not be the earliest possible, but the most feasible time. So in informed consent, as we discussed in with Dr. Alizi before, you need to mention what are the nature of the therapy that the patient is going to follow. The nature means here whether they are going to have a one-to-one therapy, whether they are going to have a group therapy, or whether they have going to experience rotation between individual and group therapy, or maybe other mechanism involved. Okay, some therapy involve the patients to be electrocuted. Okay, it's not to the extent that going to give risk to their health, but to reduce some urge, okay, some urge in themselves. So some therapies use this technique as well. So you need to explain all that involve activities, tasks that are going to be conducted on the client. So you need to explain all of that. And then of course, when you are practicing clinical psychologists in Malaysia, for example, outside of the government policy, government facilities, they may involve some consultation fees or some professional fees. So you need to explain to them. You need to explain whether that fees will be covered by the client themselves or will be covered by the third parties, their families or the insurers. Okay, maybe they have insurance which covers on mental health, so you need to explain on that also. okay, involvement of third parties, and limits of confidentiality. Of course, some aspect of mental health, for example, involve the safety, okay, the health of your patient or health of others. If you involve with patient who is a psychopath or sociopath, who have the tendency to hurt himself or herself and to hurt, to injure others as well. So you need to mention what is the limits of the confidentiality, what confidentiality means in your session. Okay, for 10.012, when obtaining informed consent for treatment for which generally recognized techniques and procedures have not been established, psychologists inform their clients or their patient of the developing nature of the treatment, the potential risks involved, alternative treatments that may be available, and the voluntary nature of their participation. Okay, so as a clinical psychologist and as a psychologist in general, we are always keep up to date, developing the therapy, developing the techniques, developing the treatments that are suitable and most efficient and effective to the clients. Okay, sometimes the available treatment, the available therapies that are being conducted to the patient is not suitable, okay, it's not effective. So you might be experimenting with a new technique combination of several therapies, for example, or you just learn a new techniques but have not been tested before. So you need to also inform your patient, okay, your client, that this is a new techniques, have not been used before, but you think it is possible, it's going to be effective for the client. So new techniques, you need to inform them, and you need to inform. Say for example, you've been conducting a certain therapy, say for example cognitive behavioral therapy. After the third or the fourth session, you believe that it's not working, it's not effective. Okay, so you want to combine this cognitive behavioral therapy with psycho-spiritual therapy, for example. Okay, say for example your client is Muslim, you want to include some aspect of the religiosity in your therapy. So when you want to introduce new techniques, okay, new treatments, okay, new activities, so you also need to acquire new informed consent from your patient, okay, from your client. You need to inform them. If say for example they are not agreed to your suggestion, okay, to your new techniques that you want to implement to, so basically you cannot administer it to them. For 10.01c, when the therapist is a trainee and the legal responsibility of the treatment provided reside with the supervisor, the client or the patient, as part of the informed consent procedure, is informed that the therapist is in training and is being supervised and is given the name of the supervisor. Okay, for most of cases, especially in our governmental facilities, okay, in government hospital, when you go there, they will be practicum students. So these practicum students is not the undergraduate student. They are usually the master students who are in their second year of their masters. So they need to go and conduct their practicum. So for the senior practicum students who are in their second semesters, they are allowed to entertain, okay, allowed to entertain their patient or client, okay, for sometimes for the screening, okay, want to identify what types of psychological problems that the potential client have. So when they want to get involved in therapy, and say for example the practicum student who is the one who are going to conduct the therapy on the client, so client need to be informed that the one who are going to conduct the therapy is not the professional clinical psychologist or the experienced clinical psychologist. Instead, the practicum student who are going to conduct that. So therefore, you need to acquire the informed consent from them. Say for example, the client do not agree, okay, to be the patient of that practicum student. So basically, you cannot allow, or you should not conduct that or continue using or instructing the practicum student to conduct the therapy. So the professionals, clinical psychologists themselves need to conduct the therapy. What happened in Malaysia is we are basically having a very limited numbers of clinical psychologists, and with more awareness now, there are more cases. Okay, there are more cases of mental health that requires professional attention. However, we don't have enough clinical psychologists, especially in government facilities. So therefore, sometimes we do require master students, okay, or practicum students to conduct the therapy session. Okay, so under the same standard, informed consent to therapy, there is special issues which is discussed in your textbook, which is informed consent involving children and adolescents as clients of children and adolescents patient. So psychologists providing therapy and counseling to children and adolescents, they face a unique informed consent challenges. Okay, it's because they are at the age whereby they might think that they can think maturely. Okay, they can consider their own importance and their own rights. But according to laws, because they are still under the age of 18, we need to ask information from their guardian, for example, from their parents. So in this aspect, okay, psychologists providing therapy and counseling to children and adolescents face unique informed consent challenges, which are tied to, first, state and federal laws governing the rights of minors to autonomous healthcare decision. Okay, sometimes, or most of the time in Malaysia, for example, those who are below 18, we need to get, okay, or they themselves need to get permission from their parents or from their legal guardians. Okay, secondly, laws related to the rights and obligation of minors' legal guardians. Okay, who is their guardian? Say, for example, they are orphans, they don't have their parents with them, so who can give the consent? Okay, besides the children themselves, the teenagers themselves, who are the responsible parties who are able to give the consent? Okay, and C, developmental changes in children's ability to understand their rights, the nature of their disorders, and the purpose of treatment. So when we want to get the informed consent, we need to consider these three factors. And the third factor is developmental changes. Okay, sometimes or most of the times, therapy requires a long period of time, 6 months, 8 months, sometimes 12 to 18 months. Okay, along that way, say for example, the students or the clients who are brought upon you, someone who are 17 years old, okay, by the middle, okay, or during the duration of the therapy, that student is going to reach 18 years old, and he or she are able to give consent by themselves. So you need to aware of that. Okay, aware of that after they reach the 18 years old, whether you need to acquire a new informed consent. Okay, whether those clients have the rights to terminate, okay, to terminate the informed consent that been given by their parents or not. So you need to be aware of that. When we working with children and adolescents, psychologists must constantly balance, okay, between ethical obligations to protect the client, okay, to protect the teenagers, to protect their welfare with respect to the client's patient development of autonomy and privacy. So like I mentioned, if you have cases where 17 years old girls being brought upon you, but you need to acquire when they reach the age of 18 years old, when they have their own rights, okay, when they have their own choice, they have their own freedom of choice whether to continue with the treatment or to stop with the treatments. Okay, so again, under informed consent to therapy, there is a case or there is an aspect of when guardian consent is required by law. Okay, so according to standard 3.10, when you discussed before under informed consent, for persons who are legally ineligible to provide informed consent, psychologists must obtain guardian permission. Okay, they need to provide the client or they need to provide the patient with an appropriate explanation, seeks the client or the patient's assent, and consider such person preferences and best interest. Okay, so especially when it's involving school children, okay, primary school children or secondary school children, so we need to get the permission, okay, the informed consent from their guardian, from their parents, okay, or from their siblings, okay, from their uncle. Okay, in this case, we need to obtain their permission, and at the same time we need to provide all of the explanation. Okay, say for example, you are counselors in school. Okay, you are counselors in school, and then when you do mental health screening, you found that a couple of students in your school demonstrate tendency for suicide. Okay, want to commit suicide. Okay, there are two situations in there. Sometimes when you approach them and they agreed, okay, to be examined further. Okay, the screening itself is not enough, so they need to be examining further whether they really have, okay, the clinical condition of want to commit suicide. Okay, in this case, you need to ask permission from them. And then you need to ask permission from their parents and their legal guardian as well. But for some case, sometimes the student themselves, they do not want to be examined further, or they don't want to get treatment. Okay, it's happened for a lot of cases, because mental health, sometimes you feel that you are normal, but you don't realize that you are actually experiencing stress, you are experiencing depressed, okay, you are experiencing disorders, or you want to commit suicide, okay, out of ordinary. So you need to provide appropriate explanations, and then you need to ask for their informed consent. And if they don't give it and they are minors, okay, they are below 18 years of age, you can go and ask from their parents. And you need to consider as well whether they prefer into certain therapy or certain treatments. Okay, whether they want to do with a group therapy or not. What are the aspects that they like, right, in their own best interest. Sometimes their own best interest is not what they show to you. Okay, they don't want to be treated. Okay, they don't want to be examined further, but for their own health, for their own safety, you feel that okay, they need to be examined further. Maybe you can refer them to their to other authorities, or refer them to the professional clinical psychologist if you are the counselors in the school. Okay, this standard, okay, 10.01, this standard respects the developing autonomy needs and rights of minors, okay, of teenagers, of children, by requiring that they receive developmentally appropriate information regarding the reason for and nature of the treatment, and with some exception are given the rights to refuse treatment. Okay, even though they are school children, even though they are primary or secondary school children, when appropriate, you need to explain the treatment. You need to explain the nature of the treatment. You need to ask whether they like it, whether they give them more freedom, autonomy, or not regarding the treatment and the whole process of therapy. Okay, when guardian consent is required by law, exception, okay, there could be exemption to that. There could be exceptions to the requirement for child assent arise when children are too young or too impaired at the time of treatment is initiated to appreciate their disorder or understand the nature of the therapy, especially when treatment is necessary for their well-being. Okay, sometimes they are too depressed, they are too stressed, okay, they are about to commit suicide. Okay, there is no point for you to go and ask informed consent first. Okay, why? Because at that particular time, they are not fit to think properly. Okay, they are not able to think properly. So basically, you can go and ask informed consent from their parents, or you need to treat them first until they are stabilized. Okay, when children's mental health needs indicate that their distance will not determine whether they will receive treatment or not, psychologists should provide them with an appropriate explanation, but not seek their assent. Okay, in many cases, the more important informed consent, the more important permission that we need to get is from their parents. Okay, sometimes parents realize that there are something problem with their children. Okay, they isolate themselves. Okay, they don't talk too much. Okay, they don't behave normally. So the parents send them for treatment. Okay, for treatment. So in this case, even though the children don't have the rights, okay, to refuse the treatment, okay, not to be examined by the clinical psychologist, but you as a clinical psychologist, you as someone who are going to provide the therapy, you need to explain to them, not to ask for their informed consent, but to explain to them the procedures, okay, why they need to go to the therapy, they need to be examined, okay, explain them in a proper way, in an appropriate way, but in a way that we don't ask for their permission, but we need to explain as well to them what is going to happen, why you need to conduct that. Okay, so when guardian consent is not permitted or required by law, okay, sometimes there are cases whereby we don't, even though they are minors, okay, they are underage children, but we don't have to go and ask permission from their parents or from them themselves, okay, such as, okay, people or children who are physically abused by their family members, or sexually abused by family members, and they develop suicidal ideation, or they develop depression, okay, or they run away from their family. So in this case, for the benefits or for the best interest of the children themselves, we don't have to go and acquire informed consent, not from them and not even from their family or from their parents. So parents are given significant responsibilities and rights to consent to healthcare treatments for their children who are below 18 years of age. Okay, psychologists should be familiar with relevant state and federal laws before they consider treating a minor client or patient without guardian permissions. What are the circumstances? What are the situations which allow us to examine, okay, to conduct therapy, to examine their mental health, to examine their disorders? Okay, what are the situations? Okay, for example, the situation that I just give just now, which is sometimes in abuse. Okay, in abuse case, okay, psychologists providing counseling services in school, for example, should also be aware of district rules, okay, rules and regulation in the state, rule and regulation in Malaysia, and federal laws restricting services to children without parental consent. So we need to be aware of that. Okay, so there are cases, I think, quite famous back maybe around 2016 or 2017. Okay, this lawyer, okay, this female lawyer is quite famous. I don't want to mention her names in this video especially. So there are cases whereby a young female Malay Muslims, I think she's 17 years old, so she wants to commit apostasy. Okay, it's not a mental health, okay, but the case may apply to you. So want to commit apostasy, want to change her religion, but she's still minor. So what happened is the parent realize and know about that. So the parents basically lock or don't allow the children to go out, okay, even to go to school. So they send her to hospitals to check for mental health status, as well as acquire advice from religious authorities what they can do to help their daughters. So what happens, so some of the friends of the children know about this lawyer who are helping Muslims, and this lawyer also Muslim, to change religions. So what happened, this lawyer go to the hospital and somehow kidnap these teenagers and protect her in her own house, okay, in the lawyer her own house. So they are basically a little bit of quarrel and legal cases whereby this lawyer bring this issue to the court, and even the parents make a police report mentioning that this lawyer have taken their daughters without permission, without their consent, and what they do is basically for the best or for the rights of their own daughters. And this lawyer counterbacks is basically what the parents do is not for the best interest of the daughters, because daughters don't want to go to the clinical assessment and don't want to be treated by the religious authorities. So it could happen to you as well. Okay, sometimes the parents want to treat their children, but the children don't want to, or maybe the children want to be treated, but the parents don't want to. And in this case, you need to be aware what is the law, okay, what is the rules and regulation in our country, in our state, in the state that you are practicing your clinical services. Okay, so that is basically all information under the standard 10.01 informed consent to therapy. Okay, standard 10.02 therapy involving couples or families. So there are two standards related to therapy involving couples or families. Standard 10.02A, when psychologists agree to provide services to several persons who have a relationship, okay, such as spouse, significant others, parents and children, they take reasonable steps to clarify at the offset, at the beginning, which of the individuals are client or patient and the relationships the psychologist will have with each person. This clarification includes the psychologist's role and the probable uses of the services provided or the information obtained. Okay, sometimes they involve a very sensitive information during the therapy. Okay, sometimes you ask them what are the main stressors, what are the main factors that makes your client feel irritated, stressed or depressed, for example. So information that will be given, okay, when your client respond to that might be related to their family members. Okay, might be related to their family members. That's why this standard try to minimize any potential issues that might happen in the future. Okay, might happen in the future. So in this aspect, you as a clinical psychologist, as the therapist, have the rights to determine whether it is best for them to be involved in group therapy or they can be in individual therapy session or a combination of both. Okay, for standard 10.02B, if it becomes apparent that psychologists may be called on to perform potential conflicting roles such as family therapists and then witnesses for one party in divorce proceedings, psychologists take reasonable steps to clarify and modify or withdraw from their roles appropriately. Okay, sometimes the depression that being experienced by your clients could be because of the conflicts. Okay, could be the issues of your client's marriage, and then when your clients file for a divorce, okay, file for separation from their spouse, so they cite you, okay, they cite you as one of the witness that they are basically experiencing depressions due to their marriage. Okay, in this case, you as a clinical psychologist, you need to specify early on. Okay, if that happens, whether you are willing or you are not willing to be the witness, okay, to clarify. Okay, in that case, what is your role? Whether you are able to involve in the marriage conflict or not. Okay, so in the therapy involving couples or families, we clinical psychologists, we need to early on clarify what is our roles, what are the scope of the or the nature of the therapy will be involved in the session. Okay, so for standard 10.03 group therapy, when psychologists provide services to several persons in a group setting, they describe at the outset the roles and responsibilities of all parties and the limits of confidentiality. Okay, similar to the one that we've discussed just now for couples or for family. So when it's involved group therapy, sometimes it's very efficient and it's very effective. However, when it's involved a lot of other persons in the same session, okay, there might be conflicts arising, okay, potential problems that arise in the future, especially when you ask them to express all about their true feelings, okay, and in the presence of others as well. So it could cause a future conflict. So in this case, you need to set up what is the rules, what is the roles, okay, rules and roles of every person, what is the responsibility of every person, what is the boundaries of every information or every person can say during the session. Okay, so such informations may include discussion of A. Differences between the exclusivity of the therapist's attention in individuals therapy and the attentions to group dynamics in multi-person treatments. Okay, and B. Group member responsibilities, including turn taking and prohibitions against group members socializing outside of the therapy session. And C. Policies regarding such client or such patient responsibilities as acceptance of diverse opinions, abusive language, coercive or aggressive behaviors, or member scapegoating. Okay, scapegoating basically you blaming each other. Okay, so in this case, like I mentioned just now, so we need to clarify early on, before the start of the group therapy session, what are the difference between individual therapy, pet therapy, group therapy, and the dynamics of everyone who are involved in the therapy session. Okay, and then you need to clear out, okay, what is the do's and don'ts when they involve in the therapy. Okay, what are some sensitive words that you cannot use. Okay, what are the boundaries of the expression of feelings and the use of language that people can do or can use during the session, and the policies regarding the diversity of opinions, different opinions, okay, various opinions. Okay, the use of abusive language, okay, in some culture is acceptable, but in some others is not acceptable. Okay, so you need to clarify everything that is going to be conducted in group therapy to everyone, to every members early on. So next, standard 10.04, okay, providing therapy to those served by others. Okay, to serve by others. Sometimes it happens. Okay, sometimes it happens. Sometimes the patient themselves feel that they need more. Okay, they need second opinions. Okay, they need more services. Okay, sometimes it requires services. Okay, clinical, the therapist from other person as well. Okay, from other clinical psychologists as well. It happens. So in deciding whether to offer or to provide services to those already receiving mental health services elsewhere, psychologists carefully consider the treatment issues and the potential clients or patient welfare, okay, including financial status. Psychologists discuss these issues with the client or the patient or another legally authorized person on behalf of the client in order to minimize the risk of confusion and conflict. Consult with the other service providers when appropriate, and proceed with caution and sensitivity to the therapeutic issues. Okay, sometimes it's okay to proceed having two therapies at the same time, but sometimes it's not advisable. Okay, sometimes it could be clash of opinions. In the case that it could happen, say for example, you are meeting someone who are expert in cognitive behavioral therapy. Okay, but you think that you also want to look for psycho-spiritual therapy. Is someone who can conduct Islamic psychotherapy to you. So you meeting two experts, but the expert must know that your client, okay, you must know that your client actually receiving treatment from others as well. Okay, you need to mention that. What are the boundaries? Okay, what are the limitations? Okay, what are the potential problems? Okay, if they are asking or they go and seeking two treatment at the same time, of course it will incur more costs. Okay, then who's going to bear the cost? Whether their insurance company allow them to claim for both services or not, maybe one only. Okay, so what are the limitations? What are the do's and don'ts that can be done if they are asking for two treatment? Okay, so next, 10.05, standard 10.05, sexual intimacies with current client or with the current patient. Psychologists do not engage in sexual intimacies with their current clients in any conditions. Okay, the term sexual intimacies is broadly interpreted and includes fondling, intercourses, okay, kissing, masturbation in front of a client, telephone sex, touching of genitals, erotic huggings, verbal invitations to engage in sexual relationships, or communication intended to erotically arouse the patient. Okay, all of these are prohibited. If you are clinical psychologist, you are not allowed to do any of them. Okay, the ethical obligation to avoid sexual intimacies with client lies solely with the therapist, not with the client. Okay, any sexual intimacy between psychologists and clients represents a violation of these standards, regardless of whether client initiated sexual contacts or voluntarily or involuntarily responded to therapist overtures. Okay, thing is like this. Sometimes you need to treat clients who have sexual disorders, okay, who cannot control their sexual urge. Okay, so in this case, sometimes you are okay. Okay, you are not initiating the romantic relationships. You are not saying something which is inviting. You are not harassing, okay, verbally or sexually to your clients. But sometimes the clients who initiate it because they have this sexual urge problem. Okay, if I remember the first, I think around 2014, 2015, when Tiger Woods was being chased around by his former mistress before, his former wife before. So it turns out that Tiger Woods have this sexual disorder problem. Okay, sexual disorder problem. I can say his name because it's in your public domain. So basically it exists. Okay, sometimes if you are male therapist, your female client who have this problem, and they are the one who are seducing you into sexual relationships. Okay, sometimes not even involve physical touch, but only talking something sexually elicited conversation. Okay, you are talking something very intimate, okay, very romantic in nature. Okay, in all of those cases, is not allowed, even though you are not the one who initiated it, even though the patient is the one who are doing it. You need to avoid on involving in any of those conversation, any of those activities or action. Okay, it's not allowed, even though you would not initiating it, even though after some time you developing maybe the urge to try it. But please remember that as a clinical psychologist, as a therapist, you are prohibited from involving in these sexual intimacies activities. Okay, next, standard 10.06, sexual intimacies with relative or significant others of current therapy clients or patient. So different from standard 10.05, intimacies with current clients. This is not the client themselves, but sexual intimacies with the relatives of the client, or the family members of the client, or the significant others. Okay, it could be their boyfriend, girlfriends, their cousins, to your client or to your patients. So similar to standard 10.05, psychologists do not engage in sexual intimacies with individuals they know to be close relatives or the guardians or significant others of their current client or current patient. Psychologists do not terminate therapy to circumvent these standards. Okay, sometimes, say for example, the client is a brother of a very beautiful woman. So he come to your therapy, come to your center, come to your service center with their sisters. Okay, with their sisters, and then you fall in love with the sisters, and then so because you know that you cannot have sexual intimacies with the sisters because the sister's brother is your current patient, is your current client, so you terminate. Okay, you terminate your therapy contract. Okay, you terminate your clinical process or clinical contract with the clients so that you can contact the sister. So it's also not allowed as a clinical psychologist. Okay, it's not allowed by this standard 10.06. Okay, 10.07, therapy with former sexual partners. Okay, therapy with former sexual partners. Say for example you are married, okay, and then you got divorced. After a couple of years, and then your partners, okay, say for example your husband have a problem, depression, okay, depression problem, and you are the experts, okay, you are the clinical psychologist in the area, and then he comes to meet you to ask for a therapy, okay, to ask for treatment. Okay, in this case, psychologists do not accept as therapy client or person or person with whom they have engaged in sexual intimacies before. So in other words, if you are married and then you got divorced, and then your partner come to see you and ask for treatment, you cannot treat them. Okay, you cannot treat them. You have to refer them to other clinical psychologists. Okay, you have to refer them to other psychologists. Okay, why? Because they have the experience with you as the partner, as a sexual partners. Okay, 10.08. Okay, sexual intimacies with former therapy clients. Okay, so what happened? Okay, say for like we learned in 10.05, 10.06, 10.05, you cannot have any intimacies, any sexual relationships with your client. Okay, you cannot even have a sexual relationship with the members, with the relatives, with the significant others of your current clients. So what happened if they are your former client? Okay, they are your client the past 3 years. Okay, they are your client for the past 4 years. Okay, they are your client for the past year. So what happened? So standard 10.08, there are two standards applicable here, standard 10.08A and standard 10.08B. Okay, so standard 10.08A, okay, 10.08A, psychologists do not engage in sexual intimacies with former client for at least 2 years after cessation or termination, or after the completion of the therapy. In other words, if the client is basically 4 years ago, 3 years ago, then you can have the relationship. However, if say for example they just completed the therapy last year, okay, the duration of the completion of the therapy and now is only 1 year or not before 2 years, then you cannot have relationships, okay, except they are more than 2 years. Even that, there are more conditions to that. Okay, why? Standard 10.08B, psychologists, we do not engage in sexual intimacies with former client even after 2 years interval, except in the most unusual circumstances. Okay, what are the unusual circumstances? Psychologists who engage in such activity, okay, sexual intimacies, after the 2 years following the termination or following the completion of the therapy, and or having no sexual contact with the former client, bear the burden of demonstrating that there has been no exploitation in light of all relevant factors, including the amount of time that has passed since therapy terminated, the nature, the durations and the intensity of the therapy, the circumstances of termination, the client's patient personal history, the client's current mental status, the likelihood of adverse impact on the client, and any statement or action made by the therapist during the course of therapy suggesting or inviting the possibility of a post-termination sexual or romantic relationship with the clients. Things like this. Sometimes after the 2 years, okay, after the completion of the therapy, and then for the next 2 years, you don't have the sexual relationships, okay, you don't have the sexual intimacies with the client yet. However, you keep in touch, okay, you keep in touch with the intention that you want to establish sexual relationship, you want to make him or you want to make her your boyfriend, your girlfriend, your husband or your wife. But you know that within 2 years you cannot establish that relationships. You keep in touch, okay, even though already completed the session and he or she already recovered and can live normally without any treatment. Okay, they no longer demonstrate any mental health issues. You keep in touch. Okay, you keep in touch. Why? Because you want to establish relationship after 2 years. So basically, you do something within that period of time. Okay, you keep in touch. You keep on giving gifts, for example. You keep on asking what are they doing. Okay, you keep on texting. You want to meet them to establish whether they are really completely recovered or not, with the intention that you want to establish sexual relationship. Okay, you want to make him or her your boyfriend or your girlfriend, your husband or your wife, so it's not allowed as well. Okay, or you mentioned that after completion of your therapies, you express your feelings that you love him, you love her, but you cannot have relationship now because you need to wait for 2 years. So after 2 years, I'm going to marry you, for example. Okay, there's the last one, any statement of action made by therapist, also not allowed. Okay, not allowed. And if it's found like that, and then it's basically you're going to have problems with your license. Okay, with your license. So that is standard 10.08, sexual intimacies with former client. So standard 10.09, interruption of therapy. Okay, interruption of therapies happen a lot when entering into employment or contractual relationships. Psychologists make reasonable efforts to provide for orderly and appropriate resolution of responsibility for client care in the event that the employment or the contractual relationship ends, with paramount consideration given to the welfare of the client patient. So it's happened a lot. Okay, sometimes when the family know about their family members are having session with you, having therapy session with you, so they don't want their family members to continue. So they interrupt the therapy. Or say, for example, your client is under employment, and then after 6 months of the therapy, and then the employment contracts, okay, not with you, okay, the employment, which means that the place that they are working do not continue their contract. So basically now he or she, your client, need to bear the cost themselves, and they don't have that financial capabilities to pay for the services. Okay, it's interruption of therapy. Or say, for example, during the therapy session, you are moving out from the country, or your client are moving out from the country, or moving out to other places, and they do not, they are unable to continue the therapy session. Interruption of therapy. So for all of these scenarios, for all of these cases, you need to provide appropriate measures for your client with the intention is to protect their welfare. Okay, say for example they are not able to continue because of financial reasons. So you are a professional clinical psychologist in a private institution, so you can recommend them to meet clinical psychologists in a public institution whereby they don't have to pay, okay, the professional fee, for example. So say for example they are moving out of the country to other places, so you can recommend them who to go and meet, okay, if they experience certain onset, okay, certain symptoms. So it's basically the what we call the signs that they need to go and ask for professional help, for example, for professional help. Or say for example their family members prohibit them to come and continue therapy, then maybe you can refer the case to authority, for example. So provided within the legal system, the legal boundaries. And then lastly, terminating therapy. Okay, standard 10.10. So there are three substandard, or there are three standards related to terminating of therapy. 10.10a, psychologists terminate therapy when it becomes reasonably clear that the client no longer needs the service, is not likely to benefit, or is being harmed by continued service. Okay, sometimes your client are so proactive, okay, they are so responsive towards your treatment. Say for example, you are conducting therapy for the duration of 6 months. Okay, 6 months, and then at the first they don't really responsive, and then you continue for another 6 months. But on the 8th month, your patient are so responsive. Okay, they no longer demonstrate any problems with their previous issues, with their previous mental health issues. So at that particular times, you should terminate. Okay, you should stop. Okay, why? You cannot have the attention that you need to do to complete the whole cycle, so that you will get the payment. Okay, why? Because there are no benefits for the clients to continue being in the therapy. Or for example, during the session, you notice that instead of getting better, your clients are getting worse. So maybe it's not suitable with you, or not suitable with the treatments, then you need to terminate the therapy. Or say for example, after being in your session, okay, involved in the therapy, so it's developed something like the sexual intimacies, okay, sexual relationships, then you need to terminate. Okay, 10.10b, psychologists may terminate therapy when threatened or otherwise endangered by the client or patient or another persons with whom the client or patient has relationships. Okay, sometimes they threaten you, okay, to injure you, okay, to harm you, okay, in one way or another. So you have the rights to terminate the therapy. Okay, also for examples, you are giving therapy for marriage conflicts, okay, marriage conflicts, and the husband or the wife of your clients keep on threatening you, okay, keep on harassing you. So you have the rights to terminate the therapy. And then C, 10.10c, except where precluded by the action of client or third-party payers prior to termination, psychologists provide pre-termination counseling and suggest alternative service providers as appropriate. This is the one that I mentioned in the first one. So sometimes because they're no longer able to pay your service, or sometimes because their employments are terminated, they have to bear the cost themselves, or sometimes because of their insurance no longer cover that. So before you terminate, you need to provide counseling, and you need to guide them. So what are the alternative services that they can go and explore, and that they can go and ask for the services to be continued. Okay, so you need, before your termination, you need to give them counselings, and you need to give them alternatives. Okay, so that's all the 10 standards for therapy. Okay, if you have become clinical psychologist later, so you might experience all of these scenarios, and you need to remember and adhere to all of these standards. So basically, in this video, I have explained about 10 standards, starting from informed consent to therapy involving couples and families, okay, group therapy, and providing therapy to those served by others. Sexual intimacies with current therapy clients, okay, sexual intimacies with the relatives or significant others of the current client, or therapy with former sexual partners, okay, sexual intimacies with former clients, okay, interruption of therapy, and terminating the therapy. So like I mentioned, so this is this is the last topics in our course information. So I hope you can understand from this video, and all the best for your final exam. Okay, thank you, and see you again later.